So we'll start by setting the scene, which I think is quite vital, even for a learned audience such as this one, who are accreditation experts from all around the world. I'm obviously not going to be talking about what is accreditation, but I think we really always have to take one step back and think about what is it exactly that we're trying to achieve through accreditation, because as we know, there are different models and programs in different countries that actually if you dig below the surface, are actually designed to accomplish different outcomes. So we can't know whether it's effective or not without first really being precise with our thinking about what its aim is. I'll then review a synthesis of published evidence. So I co-authored a paper that was published in the International Journal for Quality in Healthcare last year, which was an umbrella review. So that's a systematic review of systematic reviews. I'm obviously biased when I say this, but I believe it's probably the most holistic attempt to synthesize hospital accreditation evidence that's been undertaken to this point. There's a lot of detail within it, so I'm just going to try and touch upon some of the highlights from that paper, and through that then sort of raise to the surface some of the practical and research challenges that paper ended up concluding with. We'll conclude the session with maybe a few, I've put recommendations here, but perhaps that's too strong a term, some suggestions for areas that we can progress accreditation in terms of practice and research, and then have some time for Q&A at the end. Thank you for your introduction. I won't labor over this point at all. Perhaps one additional item that I would add to my biography is that I noticed that Professor Carsten Engel has joined us. I became a deputy editor of the ISQua journal, the International Journal for Quality in Healthcare recently, which I'm very thankful for. So I guess in some ways that perhaps is a mark of how I'm seen as an accreditation researcher at an international level. Okay, so setting the scene. As we all know, we're in the business of trying to look after patients to improve health and well-being in communities that we serve. Yet the flip side of that is that harm does occur from healthcare. There are many who believe that's an inevitability, right? Because of the complexity, particularly in hospital settings of healthcare delivery. However, there are examples from other industries that are arguably equally as complex, where they've taken an approach of, let's say in the road safety space in Scandinavia and Sweden, something called Vision Zero. So the vision being that no deaths should occur on the road. Now, I'm not naive enough to think that that would be palatable to clinicians throughout the world who are faced with such challenges on their time when they're delivering direct patient care. However, we probably have to ask ourselves, whether it might be worth at some point in the future actually, striving for something that may seem impossible at this point, but with advances in digital health and new understandings of healthcare system design and health service management and delivery systems, perhaps it can be strived for in the future. And indeed it must, because if we think about the scale of the patient safety challenge, the quality and safety challenge, particularly in low and middle income countries, it's obviously quite confronting. I won't go through all of these statistics here. You can see the sources. I've included links to all my sources on each of the slides. I'm happy for this slide deck to be shared with anyone who wants it as well. So we can see here that in terms of the human cost, right, and the financial cost to low and middle income countries and indeed high income countries as well, clearly more needs to be done in regards to enhancing quality and safety in healthcare, with hospitals obviously being the spear of the phalanx. Now, it's always very tricky, particularly as somebody who's not a clinician themselves, to have these kinds of conversations, right? Because I'm not there, getting my hands dirty, dealing with the day-to-day struggles, particularly in resource-poor settings, of trying to find the time to actually conduct quality improvement initiatives and so on, when the main focus is on providing direct patient care. So I think, again, we need to take that very balanced perspective of thinking about the amazing successes that have been made over the past couple of decades as quality and safety has moved increasingly onto the healthcare agenda. But also accept that there have been some, some failures along the way. That is also true in terms of accreditation. So we can see organizations like within India and programs that have been extremely successful and are continuing to be so. However, there have been a lot of examples, again, particularly in low and middle income countries, of programs being set up and then slowly falling away. And that's due to a number of reasons. Indeed, one of my current PhD students, who's the former Director of Medical Services in the Sri Lankan Ministry of Health, is actually looking at the topic of, what are the key factors to ensure that new accreditation programs in LMICs are actually sustainable and produce positive impacts, not just immediately, but over time. So we know in the general accreditation aims, that adherence to evidence-based standards should in theory improve clinical, organizational, and indeed system level performance, increase public trust, and access financial incentives, or allow health service organizations to access those incentives. It's a very important point there because, and I think Dr. Parag, you mentioned indeed that, looking at that financial dimension of accreditation is really vital. So if individual patients don't have faith in the quality of particularly, let's say, public hospital services, then they're less likely to use them, which means those services are less likely to receive financial, payments from national health insurance programs, which means there's less resources to invest in quality improvement and patient safety. So there is quite a circular phenomenon involved in this, where it's a bit of the chicken or the egg, but certainly having that marker of quality will increase public trust and allow, in theory, more financial sustainability for the organizations who are members of those programs. And there's also quite often the hidden sort of function of accreditation, which is knowledge translation and exchange, both within and across health sectors and systems. I think that's really important and something that your organization and ISQua really is quite focused on. Not just viewing the program as the standards and assessment processes, etc., but actually viewing it more broadly in terms of how can accreditation be a catalyst for creating a community of quality and safety practice, cutting across, policymakers, clinicians, healthcare administrators, and researchers around the world. Now, there's something that's become increasingly apparent over the past decade, including in countries like my own in Australia, which is that accreditation's historical aim or purpose is starting to change. So we initially had licensing, and still this is the case in many countries. So you have licensing to essentially screen entry to, the healthcare system for whether an organization can provide service or not. And then you have accreditation, which is essentially more focused on continuous quality improvement, trying to move the bar from more organizations being competent to a higher proportion moving into that excellent sort of region, or at least striving to do so. Now, what we're finding in places like Australia is that accreditation is actually becoming, as well as a quality improvement initiative, actually a quality assurance initiative as well. So there is an evolution in what accreditation actually means in terms of the operational realities of things. We know the basic components of accreditation, but clearly two of the critical factors here are that standards need to be evidence-based, clear and updated regularly, and assessments need to be credible, transparent, and consistent. It sounds like an easy statements to make, but I've been involved in various research projects looking at those two specific issues, and there are huge challenges and huge complexity involved in both. I remember speaking to one hospital executive about the issue of consistency or inter-rater reliability, one could say, in terms of accreditation assessments. And the line that I always recall is that they described it as both an art and a science. And I think in many ways that captures a lot of the nuances of accreditation. It's something that whilst we live in an evidence-based, medicine and practice and policy world, there's always going to be a dimension of healthcare, that is art. And I think accreditation shows that. In terms of global reach, well, we can see by the the fact that there's 27 countries represented by those registered to attend this seminar this evening, local time for me, that really there's extreme global reach that's expanding constantly with support from ISQua, of course, but also from supranational organizations. So we're seeing, not just the World Health Organization, but the World Bank as well. There are often conditions put on loans for health system strengthening activities that require accreditation programs to be put in place. And I guess skipping down to that final dot point, there have been some commentators in the research literature who've raised some concerns about that and about whether these types of donor organizations are being too specific about the particular programs or standards that they mandate that low and middle income countries introduce to access those donor funds. Programs now cover, of course, not just hospitals, but multiple other sectors, within healthcare, increasing prominence within low and middle income countries due to new financing systems related to the push for universal health coverage and, national health insurance programs. And of course, there's the other dimension of medical tourism, which is a massive part of this whole story. But as I mentioned previously, programs can be challenging to sustain in resource poor settings. So, like your main program in India, I think it's designed, I wouldn't contend to be a particular expert in the specifics of that program, but I think the fact that it has different sort of levels with which members can engage in the program is actually a really intelligent way of designing it, and something that I think many countries around the world should probably consider if they're going to embark on accreditation journeys. I won't go over this too much, but just briefly, in Australia, we basically had a government takeover of accreditation in healthcare a number of years ago. So a federal government agency sort of coordinates all the accreditation scheme, the system really, and then one could say subcontracts individual accreditation agencies to do the actual work. I think it's actually a really good program, not just because of the specifics of the program itself, but actually that the Australian Commission on Safety and Quality in Healthcare provides a lot of guidance to participating organisations in terms of how they can go about meeting those standards. So whilst it doesn't mandate that there has to be a specific, falls prevention policy or infection control guideline to meet or surpass some of the standards, they give some ideas about what's worked in other contexts that organizations may want to consider if they're struggling with that particular area. And the initial evaluations have been positive overall, but extremely scientifically questionable. And that's no fault of the national organization running this. It's purely the way that this national program was implemented. It got implemented all at once, so there were no control groups, so it's purely before and after studies. And as we'll talk about it in a little while, if you have that kind of simple sort of study design, it's impossible to reach any robust conclusions. You're not meant to look at the finer details of this, but what this slide, which shows the actual process through which hospital accreditation occurs in Australia, what this slide is aiming to do is really reinforce the fact that it's not just standards and assessments and decisions at the end of the day. There's the entire process behind it, what an accreditation program is. So if we're talking about does a specific accreditation program work or not, what we need to understand are all of these processes, as well as just the standards, and as well as the assessments and the outcomes that are being produced. So how can we know how best to optimize the efficiency and effectiveness of accreditation programs without seeing it in its full holistic complexity. A word that I'm using a lot, perhaps too much, it might get annoying, but I think it's better to be honest about what we're discussing rather than try to overly simplify for the sake of ease. So this comes to some subjective views about what is accreditation. What are accreditation programs? Are we screening organizations for entry? Has it taken over a licensing function? Are we talking about quality assurance using just basic quality standards, or continuous quality improvement using a more holistic program? Or, as in many cases, there's a bit of a combination of the above. So I think whilst I can talk, as I will in a second, about the overall body of global evidence on the topic, it's really important to, for each individual when they're digesting that information, to think about, its specific relevance for the programs in your country, considering what their particular aim is. And once again, you can see this not only shows something about accreditation, but also how bad I was at using PowerPoint when I created this particular figure for a paper a number of years ago. So this was my very overly simplistic attempt to, again, reinforce the fact that when we're talking about, okay, an accreditation program, how does it influence healthcare hospitals, quality and safety practices? Well, we have to think about what are all these components of the program itself. We have to think about what's actually happening in the hospitals, regardless of accreditation, in terms of organizational leadership, patient safety culture, and indeed, professionals' views of accreditation and quality and safety more broadly. And then all of this is occurring within the macro backdrop of broader regulatory, legislative initiatives, financial incentives, professional credentialing programs, and so on and so forth. So again, this is the context in which we're discussing what accreditation is and what impact that it might be having. In terms of benefits and costs, we can see they're readily adaptable, thus the diffusion of accreditation programs throughout the world. They can assist in embedding best practice or gold standard practice, and particularly in terms of health service management, I think, around the world, and facilitate communities of practice. But they come at a cost, right? So considerable investment of financial and human resources. And there are always going to be certain professionals and certain associations representing professionals that believe by trying to overly standardize healthcare, that you're actually decreasing individuals' professional clinical autonomy, and perhaps also decreasing the drive for organizational innovation. Personally, I disagree with that. And I think that accreditation programs can be designed in a way where, it's not overly prescriptive about what precisely needs to occur. It can set the general sort of indication of what needs to be achieved, but leave that autonomy about how that can be achieved. So the simplistic way to answer the question of, does accreditation work? Does hospital accreditation impact patient safety? This is how the cynics would answer that question, right? And I'm sure even though everyone who's decided to register for this must be on board and supportive of accreditation, I'm sure there's some of you who still secretly believe it's a bit like this, where essentially the system is gamed and there's a ramp up of energy in the organization and resourcing to put a new paint of, put some new paint on the walls, ensure nothing's blocking the doorways, pick specific patients who are going to be interviewed by the assessors and so on and so forth. I believe that's overly simplistic and incorrect. This is probably more the general idea of accreditation's impact that I believe to be true. So I'm not naive enough to think that there isn't a level of gaming and ramping up of energy prior to assessments. And indeed, that's why some of the research I've conducted about short notice assessments, I think, is really important. And, assessments that can be called on the spot, which is something that's happening increasingly. But nonetheless, I think that when the key principles of accreditation are embedded, consistently over time in individual organizations and across health systems, that you do see a gradual improvement in organizational and clinical outcomes. But this is all hearsay and this is a very simplistic figure. Let's move on shortly to the hard facts. And I just thought, in light of the the context in which I'm speaking this evening, I just wanted to, share my, how impressed I am and appreciation for the quality and safety journey that India has been on for a long period of time, and the range and depth of initiatives is quite impressive at a global level. And of course, there's a range of different accreditation programs in place, with NABH being particularly prominent. And I've already mentioned some aspects of that program that I found to be particularly impressive. One thing I will say is that from the research that I've seen thus far, most of which has probably been conducted and authored by people who are actually joining us this evening, I will say that a lot of the evaluations seem to be largely focused on sort of quantitative surveys at this point in time, which indicate that the program is viewed positively by healthcare professionals in general, but especially administrators. So I think there's some questions to be asked about that, and certainly some opportunities. I'm sure there's lots more research that I'm not aware of that I'm looking forward to hearing about. But perhaps there's opportunities for for stronger sort of evaluation designs to really further strengthen the evidence base supporting the program. So in terms of the evaluation issues, again, we have to think about, okay, so if we're, does a hospital accreditation impact patient safety? Well, whose standards? Which program? What version of the standards? Which type of facilities? Not just, hospitals. That can mean many different things in different countries. What size, what complexity of patients, etc. What study designs were used? Who are the participants, and is there a risk of bias with that? And are there vested interests? So inevitably, the people who most want to know whether accreditation actually works are those who have, as they say, skin in the game, who've actually invested money, time, and energy into accreditation programs. So the flip side of that is that, whether it be government agencies or private organizations who are involved in accreditation, they do have a vested interest. So therefore, we have to be careful when those are the organizations that are driving the research agenda. I'm not actually suggesting that anything untoward. I've never seen in my 10 years in this field anything untoward, but I think it's always, something that as good researchers, we need to keep top of mind. Okay, so now that's set the scene. Now I'm going to move on to the synthesis of published evidence. So there's not going to be a drum roll where at the end of it, I say it's worked or it hasn't worked. But perhaps this will further clarify the overarching question. I mentioned the paper that it's based on, published in the International Journal for Quality in Healthcare last year. So there were 33 included literature reviews. All of these were extremely large. So really what you're talking about are hundreds of primary research articles informing the conclusions that we reached in this paper. We grouped the results into the 7 healthcare quality dimensions as a way of trying to, categorize and simplify this, complex, heterogeneous array of information. And we really just wanted to know what's the supporting evidence, like you do, right? Does it work? What are the research trends, and also what are the key knowledge gaps? So I'll go briefly over each of those 7 healthcare quality dimensions now. Of course, there was lots of diversity in terms of the study designs, the literature reviews, and also the quality of the primary studies included in those literature reviews. However, there didn't seem to be any association between the quality of a study and the types of conclusions that it reached. So that was quite interesting. And whilst we looked at the 7 healthcare quality dimensions, perhaps it's questionable whether a couple of those should have been included, but the areas that were most focused on were those that you would expect. So effectiveness, efficiency, and safety being most prominent. And safety will be the last one that I'll cover, just to save the best to last. In terms of effectiveness, there were 27 reviews that investigated that issue. So only 10 proposed positive associations. Now, when I put that figure there, that might appear to indicate that the majority of papers indicated that hospital accreditation did not promote or was not associated with effectiveness indicators. That's not the case. So most of the time, in relation to each of the quality dimensions, the papers couldn't find any, not quite a null hypothesis, but there was no strong indication one way or another. So it's not as though if 10 proposed positive associations, that the majority proposed negative associations. So I think that's an important point to note there. The papers indicated that accreditation promotes evidence-based practice, guideline development, and the use of clinical indicators to support quality improvement. And the key outcomes that were included in the primary studies were length of stay and readmission rates and mortality rates. Now, in terms of efficiency, there were 19 papers that looked at that issue. There were two broadly conflicting themes, okay? And they're quite, I think they kind of speak to some of the key questions that are in the global healthcare community about accreditation. So on the one hand, positive impacts were identified in a number of papers, and they were seen as being due to relationships with staff retention, lower turnover, being an employer of choice, improved productivity, and health resource management practices. So that all sounds very good, but then there is, of course, the flip side of the costs and the burden of engaging in accreditation. So inefficiencies were identified in a number of papers as well because of the increased costs, workloads. As we know anecdotally, a lot of clinicians feel that it really, their work in terms of preparing for accreditation takes the time away from delivering high quality patient care, which, can be problematic. And then there also can be investments required for extra equipment to meet standards. But there really hasn't been any rigorous economic studies regarding hospital accreditation, to be honest. I've been involved in one study that, tried to calculate the costs and benefits. Only the costs could be calculated to some extent. And really, there's the overarching conceptual issue here as well, which is that if your view is that organizations should be engaging in continuous quality improvement anyway, right? And have standard operating procedures and so on. And that they're not just doing that for the purpose of accreditation, that means that the costs required to engage in those internal processes should not be seen as, a cost of accreditation. So it's actually very difficult to discern what is a cost that should be directly, partitioned to accreditation and what shouldn't be. And I think that's one of the main reasons that high quality health economic evaluation hasn't really been conducted yet, in my view. Look, access and equity, which I won't speak to too much because they're usually not viewed as dimensions or objectives really of accreditation programs. But I suppose the one thing I would say about both of those points is that on the one hand, we can see in countries like Australia that there's a trend towards large, whether it's private conglomerates comprised of multiple facilities, or public health services that again have multiple facilities, that they're starting to conduct single consolidated accreditation processes altogether. And I think that in that moment, once an organization is moving or accreditation is moving from just a single organization to that broader kind of perspective, therefore, things like access and equity become much more on the accreditation agenda. So I don't think that's really occurred in earnest as yet, but it's something to keep in mind as things progress. And in terms of equity, again, there were only, I believe, two studies, two reviews that investigated that issue. Occasionally, I get a little confused in my own head as to whether my attempts to strengthen the accreditation evidence base and the industry are promoting or reducing health equity around the world. And so what I mean by that is, are we trying to ensure that there's minimum quality assurance standards across an entire sector in an entire country, Or are we basically just putting a mark of, success on specific organizations that already probably have more resources, would potentially be more effective and deliver high quality care regardless of accreditation? And through that, basically just reinforcing sort of inequity. So I personally, I think that we are doing the right thing. I think we're raising the bar and trying to drive that uplift across entire health systems, by striving for excellence. But I think all accreditation stakeholders should also, keep in mind that bigger picture of what we're trying to achieve in terms of, improving population health across the world. Patient-centeredness was another area that was frequently investigated. And you can see, some of the positive impacts here. Apologies for the long sentence, the long dot point there. So it was viewed as having potential to boost public confidence, consumer involvement, and community involvement as well in some contexts, complaints management, etc. When all of that, it obviously has an indirect impact on attracting patients. Regardless of those indications of positive impacts, most reviews found inconclusive, inconsistent, or no evidence on this particular topic. And one set of authors of one of these reviews recommended that patient satisfaction really needs to be investigated more frequently as one of the outcomes or potential outcomes of accreditation for evaluation. I would also contend that patient-reported outcome measures should be a critical part of the picture for us to be able to really further our understanding of accreditation impacts. And safety, finally. I'm wanting to skip through this so we have time for some questions near the end. So in terms of safety, rather surprisingly, there were only 16 of the reviews that investigated this issue. Conclusions, unsurprisingly, unfortunately, I was wanting to come here and give you a simple answer, but the conclusions were mixed with inconclusive results. Those that found a positive impact suggested that this was due to promoting an improved patient safety culture and also strengthened procedures in areas such as managing falls and infection control. And a safe organizational culture was considered to also contribute to other findings, such as increased incident reporting, fewer adverse events, such as post-surgery complications and infection rates as well. Now, you may be interested, you may be wanting to see the precise details that underscore these kind of summary statements. To do that, then you can look at the paper and then find the specific systematic reviews that are being referenced in this slide deck. And within that, you can actually see, as with all systematic reviews, there's extensive tables that provide the actual specific data upon which the authors reach their conclusions. Now, we've gone through the 7 quality dimensions, but there were also these other sort of impacts that were raised, which, were overall quite positive. So the overall sentiment, I would say, in the body of global hospital accreditation evaluation evidence is much more leaning towards the positive end of the spectrum, though that's, balanced by a fair assessment that, the evidence isn't particularly robust in some areas. So to sort of bring things in the final, let's say 5 minutes or 10 minutes, I'd just like to talk about a couple of key issues and then make a conclusion. So these papers seem to indicate that accreditation might only be a quality assurance snapshot, which may not be sustained. Now, I think that's, a questionable comment. I think that it's contextually specific. So in some contexts, it certainly is a simple cross-sectional snapshot. In others, there's more genuine, authentic engagement from, the industry with an accreditation program or programs for the long term. Of course, participation isn't without risk. We have to ask the question of, in Australia, as an example, there's no, how should I put it, legislative teeth, so that a government department can shut down a public hospital, right? If they fail accreditation, they might get rid of the board. There might be various periods of time through which issues can be addressed, but you can't reasonably shut down a several hundred bed public hospital. Where are the patients going to go? So that's an interesting sort of aspect of the discussion. Also, what are the negative consequences? What can be done about that? We know that there's substantial resources required to be invested in programs, which does lead to increased staff workloads and stress, particularly for our quality managers and those working in quality management departments who are joining us this evening. I'm sure you feel those 6 to 9 months of extreme stress leading up to an assessment. And yeah, so because of that resource burden, well, I guess we have to consider, the economic sustainability of accreditation in resource poor settings. In terms of research issues, we need to strengthen the evidence base. The evidence doesn't indicate that accreditation doesn't work, but I think that with more considered study designs and the funding for those and support, to implement those high quality studies, I think we can really do a good job of really further highlighting how important accreditation is. And there's a million reasons why we haven't been able to do that till now. Personally, I think, and again, it's maybe my subjective opinion, I think a step wedge randomized control trial design is probably the most realistic for us to produce high quality evidence. So conclusions and recommendations. So reviews, they often pose the question, does accreditation work? And then can't answer it because of the attempt to aggregate all these super diverse studies in terms of the programs, the standards, the outcomes being looked at, the context in which the programs are being implemented. So perhaps we need to take a step back and just try to focus specifically on creating high quality studies to evaluate the impact of particular programs in particular contexts. And hospital accreditation will obviously remain popular, despite there being not the most robust evidence base. And I'm happy for that to be the case. I think it's a really, again, I'll repeat, I think it's a vital part of what we're trying to do internationally in terms of uplifting quality and safety in healthcare. And I see no reason why that will change anytime soon. Perhaps one day in the future, in several decades, things might change. But we definitely need to also think about exploring not just does accreditation work, but why does it work? How does it work? And in what specific contexts? And that's where I think theoretical development and drawing upon the insights from implementation science will actually be really vital to take that next step in terms of progressing accreditation research. And unfortunately, like all complex initiatives, by the time that we have a super robust body of evidence about it, we'll probably be at a point where, the principles of quality and safety are so embedded across the world that we may not need a program at all. But one of the ironies of life, I suppose. And so for my final slide, I guess we need to ask the question, does an absence of evidence equate to an evidence of absence? I would say no. I think it's just, the nature of evaluating complex health services research initiatives and policies. We know that accreditation is vital, but it should not be viewed as a panacea for reducing harm from healthcare in general. And I think so some of the rhetoric from, some supranational organizations could be toned down a bit. And for accreditation to continue its amazing journey of progressing, I think there has to be better leveraging of organizational level and systems level digital health information systems. I think that's going to be vital for, real-time quality dashboard reporting and feeding information to, policy agencies and so on, who can then come in to check on specific actions and standards.